Well, hello and welcome back with Massachusetts Senate Minority Leader Bruce Tarr. And Senator Tarr, welcome back to MSO as we approach the last week in April.
Thanks, Rick. It's hard to believe that we are reaching the last week in April and we're just on the threshold of May.
Well, it's, I guess we're 13 or 14 months in now and things are progressing. The governor actually had something online today as we record this on Friday about not doing away with the mask guidelines just yet. People are getting vaccinated at a great rate. We're up to almost 50%, I think, in Massachusetts. The numbers are going down, but people still have to exercise caution. And that leads me to our first topic of the day. When this all began, there was great trepidation over the soldiers' home. I think, was it in Holyoke, where people were infected with COVID so much? And you have some news about a follow-up to that.
I do, Rick. And one of the things that we saw during the pandemic was a lot of loss in nursing homes due to COVID-19 generally. But one of the most troubling instances of that we saw was at the Holyoke Soldiers Home, where we saw at least 76 veterans that were living there perish due to COVID-19. And for these folks, who had served our country and made incredible sacrifice, this isn't acceptable. And so we need to do better. And there was a report that was done by Mark Perlstein, who was an attorney that was tapped by Governor Baker to investigate the entire situation. And that report came out on June 21st. Here's a copy of it. And here's how thick it is.
Wow.
And Attorney Perlstein went through a number of different things, but it became clear that we needed a better facility to house our veterans in Holyoke. And so discussion began about how to build that new facility. And one of the good parts about this, Rick, is that we don't have to go it alone. The federal government is willing to partner with us if we meet certain criteria. And if we submit an application, I believe it's the first week in August. If we submit an application by then, we may get 65% of the cost of constructing that new home back from the federal government. And so a bill was put together. It's a $400 million, program that would build that new facility. And if we get the federal reimbursement, the state share will only be $140 million. Now, if that was the whole story, it would be a good story. But it gets better.
Okay.
And the better part is that we are going to debate this bill in the Senate next week. And as we have been thinking about this issue, we've been looking with help of different organizations, including the Disabled American Veterans Organization and others, and begun to look at, is it enough to have one new facility in the western part of the state? Now, certainly veterans in that part of the state need to be served. But as you know, there are two of these homes, one in Chelsea and one in Holyoke. But we started asking questions about the rest of the state. And are there underserved populations that are not reflected in the census at either Holyoke and Chelsea? And the answer to that question is there are. So for instance, in our congressional district, there are a very large number of veterans. There's also a very large number on Cape Cod and the islands in Berkshire County. And those places aren't necessarily able to be served well by the only two homes that we have. And so as we move forward in this bill, and it was released yesterday by the Committee on Ways and Means, of which I'm a member, as we look at this, we're also trying to look at the rest of the state. And so not only do we authorize in the bill that was released from the Ways and Means Committee, $400 million for the Holyoke Soldiers Home, but we authorize another $200 million to look at regional equity. How can we come out into places like Cape Ann, Essex County, to be able to provide better care and better accommodation for the veterans in our part of the state? And so what began as a really important conversation about remediating a deficiency has grown to a conversation about how can we advance the entire system for the entire state. Now, there are particular rules around this. And so, for instance, the federal government has a limit for the number of beds that we can have at 944 Obviously, we don't have anywhere near that. And so if we move forward, we're hoping that we can get federal participation in other facilities as well, not only in terms of construction cost, but also in terms of operating cost, of providing care, of providing housing. And we're also trying to look, Rick, at the model to say, is the model of having one very large, very much institutional facility the best thing for our veterans? Or is it maybe to provide some congregate housing that's smaller in nature and more communal in nature than having those large institutions? And so what we're hoping to do is take this bill, which the House had passed last week. We're hoping to take this bill and move it forward and expand it and work with the House to create a more comprehensive approach. And I've got a couple of amendments to that bill, one so far, maybe two by the time we're done, and we're going to debate it next week. So it's important, I think, for folks to understand that we're trying to not only respond to the terrible things that happened in Holyoke, but we're trying to do better for veterans statewide.
It sounds pretty amazing that you're going to be looking at new ideas and new things, because we've had a model here with that kind of facility for probably 50, 60, 70, 80 years or more. And at least since World War II, I'm thinking. So that's really encouraging to hear. And maybe there'll be some really great new innovative things that come out of this.
We're hoping, and really the conversation on the second part of this, on trying to look at those innovative things, is in its infancy, but it's growing quickly, and we're hoping to accelerate the pace of it so that we can look at every available option. You know, maybe outpatient care is important to have supplemented and have more of. Maybe again, it's small group housing. Maybe it's specialty care in things like substance abuse or mental health. But we hope to look at all of it. And again, I'm very, very encouraged by the way that we've been able to expand this conversation so that, again, we're dealing with what needs to be dealt with in Holyoke.
Great.
But we're also saying veterans in the rest of the state need to have support as well.
That's encouraging news. And the other piece of encouraging news, I saw in the paper that the governor is working on this unemployment insurance debacle, if you will, or at least the rates. And do you have an update on that?
I do. We're looking at every option we possibly can, Rick. And the good news is the bills have been pushed off in terms of their due date. And we're hoping to use that time to be able to find a solution before people have to pay a very large bill. On the solvency assessment component of the unemployment insurance assessment, it's about a 1,600% increase. And we're trying to prevent folks from having to pay that and then have a solution after the fact, which means they get a rebate, or we try to work it out that way. We're hoping not to have to do that in the first place. Obviously, the idea that's in the lead right now is to use federal funding. We've got billions of dollars coming into the state as a result of COVID-19. My opinion is that we should be using some of those billions of dollars to do this, to help the employers we need to survive, to reinvigorate the economy and revitalize the economy. And I also think it's morally the right thing to do, because they didn't cause the pandemic. They had to endure a lot of sacrifice by being closed or restricted to protect our public health. So I think it's right to be able to help them with this cost. And if we do nothing, as of right now, they're still going to be paying for all of that cost. And so I think we should do something here. I'm hopeful that we will. And I think we're moving closer toward a solution every day.